Thank you, Judith. Now moving on to part two, the core functions of a palliative care nurse. So here are listed 10. The first is to apply the core constituents of palliative care in the setting where patients and families are based. So this is where they are residing, whether it be a facility or their own home. Two, enhance physical comfort through patients' disease trajectories. So this could be medications, helping them understand the disease, the symptoms. Meet patients' psychological needs, and this includes anything with mood, coping mechanisms, identifying support. Um, Four, meet patients' social needs, and this includes anything from relationships to finding hobbies, helping them find resources. Number five, meet patients' spiritual needs, and this can include anything from finding sources of strength, sources of meaning, getting closer to their religion, and finding their legacy. Six, respond to the needs of family in relation to short, medium, and long-term patient care goals. Seven, respond to the challenges of clinical and ethical decision-making in palliative care. Eight, practice comprehensive care coordination and interdisciplinary teamwork across all settings where palliative care is offered. Nine, develop interpersonal and communication skills appropriate to palliative care. And 10, practice self-awareness and undergo continuing professional development. Now moving on to essential services. The palliative care nurse provides a lot of services, including basic management of pain and symptoms, basic management of depression and anxiety, discussions about prognosis, goals of treatment, suffering, code status, and for palliative care, management of refractory pain, management of more complex depression, anxiety, grief, and existential distress, assistance with conflict resolution regarding goals or methods of treatment. So to the left, you'll see like a little diagram which highlights what the palliative care nurse does. So I was able to interview a registered nurse, a palliative care RN, certified hospice and palliative nurse for Emanate Health, and the date of the interview was on 4/22/2020. I asked 3 questions. The first, tell me about your job. So the nurse responded, I am a palliative care RN in the inpatient setting. How I explain my job to people is that I am here to provide information, education, and support to patients and families while a patient is hospitalized to assist in decision making with regards to one's medical treatment. Typically, I see patients that are facing chronic or serious life-limiting, threatening illness. Sometimes it might be an illness that a patient has been struggling with for a while or dealing with an acute change in condition. The second question I asked, what do you like best? He responded, what I enjoy most are when the patients and families express that their wishes are being honored and respected, and that I was able to be a part of that process. I will admit, when I see patients that are at the end of their life and are unable to decide for themselves and families want to continue with aggressive medical treatment, even if their loved one has no quality of life, is suffering, and further care is becoming futile because it is their wish, it is difficult for me. I need to remind myself that these are their wishes and not mine, so at that point all I can do is offer support. A positive example was of a 97-year-old female with Alzheimer's dementia from a memory care unit at a SNF, was admitted with CVA. She had completed an advanced directive years prior and named her nieces as her POA health care surrogate. It was a fairly large CVA and the patient was unable to eat for about 5 days. The attending physician reached out to the niece and suggested a PEG. The patient's niece was conflicted because she knew that in the patient's advanced healthcare directive, the patient specified she did not want anything done to prolong her life. The nurse taking care of the patient saw the niece's frustration and indecisiveness. Fortunately, the nurse asked the MD for a palliative care consult. I was able to meet with the niece and go over her AHCD and discuss with her about patient goals. Ultimately, the patient did not receive a PEG and was discharged with hospice. She passed away a week later in the comfort and dignity. The niece reached out to me afterwards and thanked me for my involvement. In my view, this was a victory, and that is what I enjoy most about my job. The third question I asked was, what are the challenges? The main challenge is dealing with death and dying. The vast majority of people don't want to talk about it. Broaching the subject can be challenging with young patients and with those who have never thought about it as an option. Certain physicians are challenging. Oncologists that work closely with the patients and families and come just shy of promising that they or their loved one will get better with more time and more treatment. Inconsistent communication about healthcare providers when working with serious or critically ill patients. So as you see, the palliative care nurse does have a lot of roles and they do go through a lot of emotional anguish as well. But it is one of the positions that we as nurses can consider going into if acute care is not the route we want to take. So here are our reference. Thank you so much for listening to our presentation.